Hi, my name is Michael Wang. I'm the CEO and co-founder of Telecare. We are a digital health platform that makes seeing a medical specialist easier and more cost-effective than ever before.
Have you ever had to see a specialist? Maybe a dermatologist for a rash, or a pediatrician for your kids. Chances are you had to wait several weeks or months, paid a hefty out-of-pocket fee, and had little transparency throughout the entire process. Telecare solves this problem. Patients can now see a specialist in 1 to 2 weeks, often bulk billed, meaning $0 out of pocket, and receive ongoing holistic support through our unique virtual care software. Telecare facilitates seamless communication between GPs, specialists, and patients, and has allowed thousands of patients across Australia to access specialist care no matter where they are, financial circumstances, or their health literacy. In the short span of 20 months, we have grown to be one of Australia's largest digital specialist and allied health providers, covering 30 specialties with over 900 medical practitioners. We continue to grow 20% month and are leading the way into digitalisation of healthcare. In the next 5 years, we hope to be Australia's largest allied health and specialist medical provider. To find out more, please reach out or join us at our virtual booth.
Hi everyone, I'm Rob. I've been really fortunate to get to know Michael and Lena as part of the squad over the last few months and hear more about their work with Telecare. Michael, welcome, and it's a pleasure to introduce you this afternoon.
Thanks,
You've
Rob.
been super persuasive in helping me understand that a virtual platform of specialists is a really important component for the future of the Australian healthcare ecosystem. But I want to start by asking you a little bit about you and Telecare. A lot of people are taking on health tech, but what's special and unique and different about the way that Telecare is thinking about the problems?
Thanks, Rob. I think one of the unique points is our business model. So Telecare provides specialist services. So we're often dealing with patients with chronic illnesses or patients with more than one comorbidity. So that means our platform has to integrate with not only providing the specialist care, but also GPs, diagnostic companies such as pathology and radiology. And the result of this, Telecare app actually provides a better holistic service and collaborative care throughout the patient journey.
That's fantastic to hear, Michael.
Yeah,
Tell me a little bit more about how you've involved clinicians in the journey as well, because I know that's been really important to you.
Yeah, and I think secondly, building a company in such a highly regulated area, we recognize that we need clinical support from the get-go and doctors to be a part of the journey. So from our co-founders, we have 2 other doctors, Dr. Sia and Dr. Wen, who are our co-founders, as well as we've built a advisory board. So with our chair being Dr. Robert Mason, the ex-General Secretary of the Australian Medical Association, and even our seed round of investors are the actual doctors who've been working on Telecare. So almost exclusively out of our 20 or so investors are the doctors who are practicing with us every day and seeing patients all around Australia.
That's awesome, Michael. I'm sure there's a lot of value to how you're thinking about the platform. Now, I know StartMate's been amazing for you, and I know that your metrics have gone through the roof. So why don't you just tell us a bit more about kind of the current state of the business and what are the metrics that you use to help you understand how you're progressing?
Yeah, so we track 4 main indicators. So first of all, it's the number of specialists, the number of GPs, the number of consultations, and the number of referrals. So big thanks to StartMate. Throughout the 3 months in StartMate, we've been able to increase our annual revenue to $2 million, over $2 million. And between the months of February and March, we've increased our referral rate from our referring GPs by 54%. So big thanks to everyone from StartMate and helping us, and Rob and the rest of the team.
That's great to hear, Michael. Thank you. I think, again, you've been really clear that this is a future component of the ecosystem. I think the big question for you guys is whether you can get there first, and your progress through this program and what comes next, I think, is really representative of an amazing opportunity you've got in front of you. So congratulations, and looking forward to keep watching your progress.
Yeah, thanks, Rob. It's an absolute pleasure working with you as well.
Thanks, everyone. That was fantastic. Next up, we have Rasas Wright. So let's all jump into that session. If you want to speak to Michael about anything, you can find him in his booth, I imagine, after this, or send him a direct message. Thanks, everyone. Thanks, Rob.